Hello, viewers. Good evening to you, and welcome to your favorite medical show, Ask Dr. Saw. We're coming to you live from TBN Studios right here in Georgetown, that's Queenstown, Georgetown, Guyana. And I hope that you had a wonderful MASH weekend. It was such an amazing sight to see so many people coming out on MASH Day here on Vicinity Road, just outside our studios, and having such a wonderful time. I pray that you're back to work and you're energized and you've had a great time. So I know there are a couple of things coming up, and I pray that everybody take everything in stride, and may you have a good Janamashmi that is coming up, and Naurat is coming up, and then there's Ramadan starting very soon. So all of us has got some great things to do, whatever religion you are, because Lent is going to be on soon. So Dr. Saw, sorry about my little rambling, but how have you been doing?
No, that's good. I think you're still in the Mashmani mode.
Yeah.
That's good.
In the middle of I hope
Celebration
that in the
mode.
middle of the show I don't bust a tune and start dancing,
No, I saw some videos on Facebook and Mashmani, and it's quite exciting. Sorry I couldn't be there.
All right, next year hopefully we're gonna have a Ask
Absolutely.
Dr. Saw float long on Match Day, it might be a good thing. Yeah,
Absolutely.
yeah. All right, Doc. So thank you so much again for all that you've been doing here for us. The show is doing great. Many questions are coming in, and last week's topic, it was a few persons called me and said they really enjoyed it because it resonated with them in so many ways. So tonight, Doc, we are dealing with leg swelling, and I've got a few questions to ask you about leg swelling. This is a common, it seems to be a very common occurrence with people, and so I want to start it by asking you though, what are some of the causes of leg swelling, Doc?
Yeah, no, indeed. I mean, as we know, leg swelling, as you say, occur in quite a large number of people, and for various reasons. And getting to the bottom of it and understanding a little bit how it happened, then it sheds some light as to the cause, sort of. So I'll just go through a little bit of what we call the pathogenesis as to how it occurs generally,
Okay.
because that's a big medical term.
Yeah.
But just to show, then you can look for causes linked to that.
Right.
So just for simplicity, I like to break things down in small ways where people can understand it a little bit more, and of course they can remember it. And that's the whole intention of our program. And I thought that leg swelling is so common. I've seen it in my practice. I've seen lots of it, and ever so often people go to holiday, they come back with leg swelling. They have
Hmm.
different types of leg swelling that they're concerned about, and I just want to decipher that and shed some light. So let us talk about so the causes. I'll divide it for simplicity into two sections. All right. So a patient comes in, say, Doc, I've got leg swelling. Now it is important to understand, is it both sides of your leg are swollen, or is it on one side? So we would say it's a localized cause, or is it a systemic cause? Systemic cause meaning it is from within the
Hmm.
systems of the body. So if it is something that is systemic, that is in the body, you would expect both legs to be swollen.
Right.
And if it is something that we would say localized, it's just localized to that area, we would expect one leg to be swollen. So that's a very simple way of looking at it, right? So let us look at localized swelling. So most localized swelling is one-sided swelling. It is just localized that particular area. So you got one leg. And then when we look at the causes, you would understand it. So, and first of all, the first thing is to understand, is it both my legs are swollen, or is it one side? So if one side is swollen, then you would look, all right, what can happen in that one side for it to be swollen? And when you look at the leg has got muscles and fatty tissue on your skin and blood vessels and all of that, right?
Yes.
But what causes swelling generally? The muscle don't grow overnight and cause swelling. The fat don't come on overnight and cause swelling.
Hmm.
So two things can do it. Either blood is stopped and blood has contained fluid, or there's fluid seeping out of the blood vessel and getting under the skin. Okay, so Akash, so when we look at the cause, we look, okay, let's see, the leg is swollen. What is the leg made of? Because whatever the leg is made of, one of those things get enlarged.
Yes.
So what are we looking at? The muscles. We don't expect the muscle to get enlarged. We don't expect the fats to get enlarged overnight or within a couple of days. We don't expect the bone to get enlarged within a couple of days. So what else is there? You have blood vessel, which is made up of cells and tissue fluid. So the blood is made up of red blood cell, white blood cell, some protein, and you got fluid. So generally the swelling is made up of fluid, tissue fluid. So it could be blood that is stuck and it causes the fluid to seep out from the veins and the blood vessel, or there's fluid in out of the blood vessel into the tissue, so under the skin, sort of, right? Yeah. So that's called tissue fluid or lymph. So you have, the body is constantly bathing, the cells are bathing in fluid, and those fluids are nutrients. And the fluid comes from the blood. There's an interface with the blood and the fluid. So you have exchange of, oxygen and nutrients to bathe the cells. And that's how you get, the cells get energy and oxygen and all of that, right? Now, so generally speaking, it is a collection of tissue fluid as a result of some obstruction to the flow of either blood or something called lymph. So let us get this, let us just shed some light on what the circulation is made of. So you have the circulation where you have blood, and then you also have lymphatic tissue. So you heard the term before, I would imagine.
Yes.
Lymphatic tissue.
Yes.
So these are tissues that has got fluid in it, and it goes in, it flows where it protects the body from infection, and it fights, it's got cells to fight infection generally.
Right.
And then those lymph fluid, they move into vessels, and they clump up into, let's say, the groin or under the arm, where you have lymph glands.
Right.
Lymph nodes.
Lymph nodes, yes. You hear about that all the time.
Nodes, right. So you have the lymph node system. So you have what we call the lymphatic system and the blood system. And the two interface, they mix together. So what tends to happen is that you can have swelling as a result of blockage of the lymph vessel. You can have it as a result of blockage of the blood flow. And those are your two common causes of unilateral swelling. And that is one-sided swelling.
Yes.
So I told you that we can divide the swelling into, is it both sides or is it one-sided?
One-sided, yeah.
One-sided could be either a blockage of the blood flow, a blockage of the lymph vessel, or it could be other causes like an injury. So when you have an injury, you twist your ankle, what happened? It's swollen.
Yes.
It's swollen because it mounts an inflammatory response. There's increased blood flow, there's release of inflammatory mediators, which cause the blood vessel to dilate and expand, and more chemical gets in, and you get all these inflammatory response, and you get swelling. And so trauma is a big cause, but most patients with trauma will come and say, right, I've had an injury and I'm in pain. So you have trauma, you have infection. So these are localized. So when you have a swelling, if you have one-sided swelling, what are we looking for? We're looking for infection. In infection, you would probably know that it's red, it's warm, it's hot. So red, hot, and swollen. Possibly infection. Or inflammation as well. And so infection and inflammation, they can present similarly. Inflammation means red, hot, swollen, painful, likewise. And you can get inflammation, for instance, if you have gout.
Oh, okay.
So that is an inflammation.
Yes.
If you have arthritis, that is an inflammation. So inflammation and infection. Infection just means the inflammation is caused by usually a bug. So the difference between inflammation and infection, I just want viewers to understand that as well. So when we say your body's inflamed means it's red, it's hot, it's swollen, it's painful. But that can be either natural inflammation where the body just mounts an inflammatory response.
Yeah.
So you can get that in an allergic reaction. So, or you get an arthritis, rheumatoid arthritis. They have something called inflammatory arthritis. You get a gout, or you can get inflammation as a result of an infection.
Mm-hmm.
So bacteria, all these fungal infection, bacterial infection, whatever the cause of the infection. Um, so that is your one-sided swelling.
Right.
Now, when we're looking at, so shall I recap that? Did you get that clearly?
No, no, yeah, that's clear. Yes, yes.
Right. Now, the other causes of swelling would be what we call systemic causes, and this will cause bilateral swelling. Both sides are swollen.
Right.
So if both sides are swollen, what we look for? We look for, first, we want to make sure you don't have heart failure. Because the heart pumps, so the blood returns to the body, goes to the heart then pumps it out of the body, goes down by the arteries to the thing, return through the veins, back to the heart, and you have that cycle.
Right.
If the blood is pumped out, it gets returned to the heart, pumps again, return to the heart, pumps again. Now, if that system fails, whereby the blood is not returning for whatever reason, or the heart is not pumping strong enough, so the blood is pooling up, you will have swelling. So the heart is weak now. So when let's say you got a pint of blood comes in, and it can only pump half a pint, what would happen? Half of it remaining backflow.
That's right. Yeah.
And it causes swelling, right? So heart
Okay.
failure is a big one. We know that the kidneys filter your blood and it controls, you form urine. So if you drink excessive water, what happens? The kidney filters the blood, it forms water with salt, and you pass it as urine.
Yes.
Now, if that mechanism fails, then of course you can get swelling as well. So when you have kidney failure, you get swelling, both sides of the leg. Now the liver failure can also cause swelling. So the liver produces lots of protein. So the blood has got protein in it that keeps the pressure in the blood itself. And I think I'd explained this in a previous video, where for water to stay into the blood, or for fluid to stay into the blood, they have to have some attractive forces. And electrolyte like salt and protein will keep the fluid intact into the vessel.
Okay.
Because if there's a tendency, when you're at school, you do this experiment where you put salt water,
Right.
water the water moves towards the salt
that's right.
section.
Yes. Yeah.
So it goes to the area of high concentration.
Mm-hmm.
So when you have lots of concentrated protein in the blood, it keeps the fluid in the blood. So when that protein is low, it seeps out of the blood. There's no pressure to keep it in. So we call that oncotic pressure that keeps the fluid in. So it keeps the blood, the fluid in the blood. So in patients who have got low protein, so liver failure can cause, because the liver makes some protein. Also, if your diet is low in protein, you can also have swelling of the leg. And in kidney failure, you also lose protein. And you can have, loss of protein. So either you're not making enough protein or you're losing the protein, you would have swelling of both sides of the leg.
All right. Cool.
And of course, there are when we look at the local, so that's both sides of swelling. And we can also talk about I forgot to mention, when you look at the one-sided causes, you get things like a blood clot, DVT.
Right.
You have things like varicose veins.
Actually, that's what I'm about to ask you, because whenever I hear about a blockage of an art, any blockage at all, since we've been doing the show, anything about blockages, I realize how serious that is. Look, at what point does the swelling in your feet requires you to see a doctor right away, Dr. Saw?
Oh, so that's a good question, because lots of time we have swelling and we'd say, fine, I will see the doctor next week, or I'll see the doctor in a few days if the swelling doesn't go down. So I would say what comes to mind immediately would be the emergency of a swelling of the leg would be if you have a blood clot, it's called a DVT.
Mm-hmm.
That would probably, that is the one that I would say, hey, that's an emergency. Don't hesitate. You need to see the doctor ASAP, make a diagnosis and get treatment, because If you have a blood clot in your leg, it's called a deep vein thrombosis, DVT.
Mm-hmm.
That clot can go to the heart, and then the heart pumps it out, and it gets into the lung. And you can die from that because it blocks the blood vessel in the lung. There's no blood flow in there, there's
Right.
no
No
oxygen,
oxygen.
and it's like you're suffocating to death
Yes.
from not having enough oxygen transfer into the blood. So that's a medical emergency. Now, how do you know you've got that? But I will tell you some other priority ones,
Right.
priority causes where we need to look at as well. But the one that would want you to see a doctor immediately would be that, a blood clot. So we don't waste time with a blood clot. But generally, there are some, you would know if it's a blood clot. So the things, well, you don't know all the time, but I'm just giving you some classic presentation. Patient comes in, one, we would look at the risk factor. We'd say, all right, the risk factors would be immobility. Sorry.
Mm-hmm. Yes.
So if you're immobile, so let's say you're in a plaster Paris, or you're in a cast, or you're in crutches, you've injured your leg, and you're not mobile. You can have stasis of blood and formation of clots. So that is one. Two, if you're in contraceptive pill, that's a risk factor for blood clots.
Mm-hmm.
So if a patient say, well, I'm in a pill, or I just started a pill and I've got swelling of the leg, one-sided swelling, so it would be unlikely for you to have both clot in both sides at the same time at the same place.
Right. Right.
So anybody comes in with a one-sided swelling, so you're looking at one-sided swelling, you're looking at pains, and if there's a blockage at one section, you would have swelling of the veins because the blood is not flowing up smoothly. There's something blocking it, so the veins get engorged. So when we look to say, is this a blood clot, we see a sudden onset that comes on suddenly.
Mm-hmm.
You have a history, first of all. So I said you've been immobile, so even returning from a flight. So if you've just taken a long haul flight, or you've been immobile, you've been sick in bed, you're on contraceptive pill, or if you have cancer, that's another risk factor. So patients with cancer, and suddenly you get a swollen leg that is painful, the veins are engorged and swollen, you should seek medical attention immediately to rule out a blood clot.
Okay.
So what they would do if you have a blood clot, we can do a test. Generally, we do a blood test and something called a D-dimer, and it will show that the level is high. So there is some evidence that maybe there is a clot there, and then we go on to have a scan, a Doppler scan. It's like an ultrasound scan of the leg to identify the clot. So lots of time you go to the emergency room. So if I suspect a patient with a clot immediately, I don't say go home and let's do it tomorrow. I send you straight to the hospital.
Mm-hmm.
The hospital will either say, fine, we do the D-dimer, it's positive. They may or may not have time to do a scan right away because you have a long waiting list for the scan. Let's say they're busy. So what they tend to do, they start you on blood thinners in the emergency room, and we will tell the patient, okay, start this blood thinner, come back tomorrow for us to scan you to confirm it.
Right.
So that's it. But the fact is you need treatment immediately.
Okay.
So that's the intention. So that's the emergency. But also you have conditions like things like heart failure. So if your heart has got the valves are leaky, or you've got a heart attack and the heart the muscles got a bit weak and they can't squeeze strong enough, you can have leg swelling, you will have shortness of breath because not only the fluid builds up in the leg, it builds up into the lungs. So you have shortness of breath because there's fluid in the lung. And of course that is a relatively, an emergency as well. Well, you need to be treated as soon as possible. And also kidney failure. So if you have kidney failure, that can be, that's something also you want to treat immediately. But the thing is, so kidney failure, if your legs were all okay and then you find that, I'm not passing enough urine, and my legs are swollen, I'm getting some shortness of breath as well, because you can have concurrent swelling in the leg with fluid build up into the lung. So when it is systemic, when it's due to the organ damage, heart, kidney, liver, you tend to have both swelling of the leg with fluid in the lung.
Okay.
So that's when you would say that. So yeah, so looking at those causes, you can have it. And there are some other causes. So we talk about infection, we talk about injury, and then we talk about blockage of the blood vessel,
Mm.
DVT. Varicose vein is
Right,
another.
varicose vein. Yes, when I remember when I was a kid, my dad in the late 80s, I think, did an operation to remove a varicose vein. I didn't know what it is then, but I love for you to touch on that because it's a very very common thing, very common
Correct,
occurrence.
correct, yes. So our body is made up of blood vessels, and just to get a bit of understanding of it, so we have what we call arteries and veins, and the artery pumps blood out,
Hmm.
and it goes to supply different parts of the body, and the veins return the blood back to the heart. So that's a cycle. And in between the arteries and vein, you have smaller vessels connected too. So you have the heart pumps out into the big arteries, and then you have a network, a mesh, like a little mesh network of small veins and arteries, and then they join back together to come into the big veins that go back to the heart.
Right.
That's how the circulatory system is designed.
Hmm.
And when you have, so the veins return blood to the heart. Now, when you have varicose vein, the theory is it's a multifactorial cause. So
Okay.
the whole idea there is that the vessels are weak and the veins are swollen. So that is called varicose. Varicosity of the vein is that the veins are swollen, so they're enlarged, and you have and they are they get all, let's say, wrinkly, right?
Hmm.
Tortuous vessel, and they are swollen.
Right.
So why it happens? We don't know the exact cause, but we know there are some risk factors. So if you're overweight, you're a higher risk of varicose vein, and there's some genetic predisposition. So the theory is that the walls of the vessels are weak, and it stretches, and your veins have got blood. Blood goes down to the parts of the body by the heart pumping. How does it get back to the heart?
Right.
The
You got
vein
it.
takes
Yeah.
it back to the heart,
Yes.
but
Yes.
what pumps it? Nothing pumps it back to the heart. So you don't have a pump in your foot that pump the blood back to the
Yes.
heart.
Yes. That's right.
So, so what happened there? When you're standing, for instance, the blood still got to go back to the heart because the blood moves from the heart to the down to the foot and comes back into the heart and pump like that.
Hmm.
So what happened when you move your muscles? The muscles squeeze the blood vessel and it milks it back up to the
Okay.
heart.
Right.
So that is why when you're immobile, so you stand for a long period and you're not moving the muscle, there's nothing pumping the blood up.
Hmm.
The muscle got to squeeze to squeeze the vessel
Okay.
to send it back to the heart, and this is what tend to happen. So in varicose vein, the walls of the vessels are damaged, and so you have some valves in the vessel. So when the muscle squeeze, it pumps up.
You close.
The blood doesn't fall back.
Right.
There's a valve protecting. The
Yes. Yes.
valve
Yes.
protect it from falling back, and this is what happened, and it goes stepwise up
Yeah.
and
Yeah.
up and
Yeah.
up. So when you have varicose vein, those valves are broken. We call
Okay.
it incompetent valves, and then the blood flow downward, and it gets all clogged up into the vessels, and that is varicose vein.
Wow.
And of course, so what tends to happen again? Most you get varicose vein, you can get it in one leg or both legs. So there are some, as I say, you can have both legs swelling or one side is swelling, but some you have a mixture. Sometimes you have both legs swollen, but one leg bigger than the other, and you can have a combination of the lymphatic blockage or the blood vessel or varicose vein. Some veins on one leg is some veins are weaker on one leg than the other, and you have that sort of they're not necessarily symmetrical.
All right. We got about 5 to 6 minutes remaining. I want to ask you quickly though. How dangerous is a varicose vein, and can it be fatal?
So no, so varicose veins are generally not dangerous or fatal, but they can give rise to complications.
Okay.
Because if the blood vessel meant to go up back, get oxygen and come down back, but the blood vessel is stuck with deoxygenated blood, that is blood without oxygen, the cells around it can die. You can have ulcers. So varicose vein, couple of things. They're not dangerous and they will kill you, but they can give rise to swelling, pains, fatigue of the muscle because you don't have a smooth flow of blood and oxygen, and they can cause ulceration,
Okay.
eczema of the skin, so you can get eczema, that is like a skin rash,
Right.
or you can have, it can form into an ulcer, and it doesn't heal because there's not enough exchange of blood in a very smooth way. So those are the complications, and besides being unsightly and cosmetically not right. So patients will go for various treatment for varicose vein,
Yes.
where you could do a couple of things. So you can either, so the first thing we would advise is lose weight, don't be mobile, so you exercise and you stay active because the veins get swollen more if you don't exercise and squeeze them. You could put on compression stockings. So compression
Right.
stockings are these tight stockings that hold the veins up and close them. So those are called non-surgical or conservative means of managing the varicose vein. Then you have surgical means, and surgery involves, there are lots of ways we can manage it surgically. Yeah, this is a few minutes more.
Yeah.
Surgically, we can cut the vein out and just take it out, strip them off.
Yeah.
So that's surgery. You just strip the veins off. But nowadays they have lots of newer techniques. They can do ablation of the vein. We talked about ablation before. So you can put heat into the vein,
Yes.
and you can inject something called a sclerosant into the vein. It's like something that bonds the vein and causes the vein to compress together. So it closes the vein.
It collapses
You
it?
can inject. Yeah, it collapses and it binds together.
Okay.
And then you can inject some foam-like substance into the vein that does the same thing, collapses the vein, and they just bind together. So those are your surgical means of doing that. And nowadays, the laser probe they can put into the vein, and
Right.
it collapses the vein. So those are your surgical management of varicose vein. In lymph blockage, the lymph vessels are blocked. You can do massage of lymph vessels, and of course you want to stay active, and of course in certain severe cases you can do surgical drainage as well.
All right.
Yep. So I think that's a summary of really leg swelling.
Yeah. Well, I gotta ask you one more thing. That something else comes to mind. At what point do you know that, like, for instance, you know the term Bigfoot filaria, right?
Yes.
Very common thing here in Guyana. So, at what point do you know that this is not just a regular leg? Well, you know what, Doc? What is this filarian Bigfoot, and as we call it here in Guyana, sometimes we refer to it as.
Yes.
And I remember a couple of years ago there was a massive push through the government initiative to get something called deck salt into people's diet and that kind of thing. What is that? How different is that from a regular leg swelling?
So filaria, like malaria, there's a parasite.
Right.
Filaria is a parasite, and it's transmitted by mosquitoes. So the mosquito pick the filaria from somebody who's infected. So it's a larva, the immature form, and it grows into the mosquito body, and the mosquito bites you, it gets infected. Now those larvae, they go and it forms a worm, filaria worm in your body.
Wow.
And those filaria worm can get lodged into the lymphatic, I talk about the lymphatic system. So the lymphatic system is the system meant to fight infection. It's like the blood system. It's a similar system like blood flow. You have lymph flow, but you have tissue fluid. And the worm gets into that system, and the worm becomes the adult worm, and it causes blockage of the flow of lymph. So it's like an obstruction. And it can get obstructed in your groin, and it causes, so the flow of the lymph, it doesn't flow back up into the veins. Normally the lymph would go and discharge back into the veins. Now that doesn't happen, and you get swollen legs. You could get hydrocele as well. Testicle gets swollen as a result of filariasis. So in Guyana we call that Bigfoot, and that is is where the filaria worms get stuck into the blood in lymphatic system. It causes a blockage and you get swelling. And usually you'll get swelling one side. So that's the type of Bigfoot one-sided swelling. And I've seen, I mean, you've seen how many people in Guyana we've got. And the condition is more common in the tropics where you have the mosquitoes. And, you know, it's a big population of patients in the tropics. I mean, close to 1 billion people at risk, really, for filariasis. So the drive generally to give you the diethylcarbamazine medication is to kill those microfilaria, because the microfilaria can stay in your body. So you can get infected and those microfilaria stays in your body for years.
Wow.
And also the worm stays in your body for years.
Wow.
So these are the people who get the worm and it stays there for years and it causes a blockage. So that's microfilaria in lymphatic filariasis in a nutshell.
We don't have much time, but two things I'm going to ask you quickly. I want to ask you about how do you manage swollen legs, but one thing I still want to get here. Why deck salt was so important?
Well, that's a treatment to kill the microfilaria in the blood. So it's a way of treating. Because sometimes you don't know when you get the organism in you.
So it's still
a national drive. Yeah,
we still should be using it, right?
Sorry?
We still should use it in our daily cooking and that kind of thing?
I don't know how it is prescribed.
Okay.
And I know in the UK we don't use that, and I haven't, I mean in Guyana, no, we use it, but I don't know how often. I'll have to look at that as to how often it should be used, and I'll have to look at the evidence to see, you know, how the dosage and how often.
Great. Well, hopefully by the next by our next show, I can, if you can have that information, we'll do some follow up. Yeah. So, Doc, management of swollen legs. We got about 3 to 4 minutes left.
All right, quickly. So management really generally you would have to do with the cause. So if somebody comes with a swollen leg, first thing you want to know, fine. So you want to know, is it an emergency? Did it happen, right? So you want to know, was this an injury? Or was it, let's say, an insect bite? Or is this an infection? So those are the important ones, because infection also can become septic. So with infection, you know you get fever, you'll get redness, you get pain, swelling. So is it an infection? Is it a blood clot? So you want to know if it's a blockage of the blood or a blockage of the lymphatic system. So that would be your one-sided swelling, and then you would investigate for that. What we would do for those investigation, I would do a blood test to see if it's an infection. Your inflammatory markers will be high, something called your white blood cell, your CRP, your ESR. That tells me there are signs of inflammation, infection in the body. We can also do a blood culture to see if there's bacteria in the blood. So, but most infection, you will see it. It looks angry and you know it's red and the skin is inflamed and infected, right?
Right.
If it's a blood clot, you will do a scan. An ultrasound scan is called a Doppler scan, and it shows you a blood clot. So that's for your localized swelling. For lymph vessel swelling, it can be difficult to diagnose because it usually takes a long time. You have to rule out all the other causes, and then you'll say, right, this may very well be lymphatic lymphedema, we call it, and it's more chronic. And there are also scanning you can do for that to establish that, and there are some imaging where you give a dye into the lymphatic system and you can do an image to see that. You can put current through the body and you see something called the impedance, how the current is restricted in areas that consist of different structure or different fluid type. You know, current travel differently through different tissue. So that is for your one-sided swelling. If you have and then you manage that accordingly. As I say, if you have a blood clot, you give blood thinners and you manage that. If you have an infection, you give antibiotics, you manage that. If you have inflammation as a result of gout or arthritis, you treat that accordingly as well. Steroids and painkillers and stuff like that. If you have now swelling on both sides, and you with shortness of breath, you know, hey, this is coming, there's fluid in the lung as well. More than likely, this is coming from the heart or the kidney or the liver. So a blood test will tell you. So anytime with swelling on both sides of the leg, you want a blood test for the kidney, liver function, kidney function, and you can do a blood test called, there's something in the heart can tell you if there's heart failure. It's called proBNP. And then you can do a scan of the heart. You want to scan the heart to see that the heart is pumping. So that's called an echocardiogram.
Right.
To see if the heart is pumping. Then I also want to do the urine test. Importantly, you should, everybody with swelling of the leg, they should check their urine if there's protein. As I said, protein, if you're losing the protein, you will cause swelling on your legs on both sides as well, because the protein keeps the fluid in the blood vessel. And kidney failure is a big cause of protein loss. So you want to do a urine test for that. So that's in summary. And depending on what it is, so if it's heart failure, there are drugs for heart failure. If it's kidney failure, there are drugs for kidney failure. Depending on the cause, we treat it accordingly.
All right,
And
Doc.
that's their summary.
Thank you so much. Thank you so much, viewers. I hope that tonight's topic and the information coming from Dr. Saw, as usual, is really good, and it's something that all of us, we should remember, and we should share this information with our loved ones too, because when you get these little things, you must know exactly how to react to them, and Doc, you're doing a fantastic job here. Viewers, we're going to be back shortly with your questions from last week. So see you on the other side.
Thank you.
Hello, viewers. Welcome back to your favorite medical show, Ask Dr. Saw. As you know, the format that we have is that the first half an hour we will be doing some information and educational programming, and then on the second half we take your questions that you will be sending in throughout this program. So tonight we are talking to Dr. Saw all the way in England, and he's going to be taking the questions from last week. Doc, I have quite a few questions here for you from last week, and I'm sure our viewers are looking forward to this. The first one is, do fibroids grow back?
Short answer, yes. They can, and there's a high incidence depending on what type of surgery you've had for it, or what type of treatment you've had. So let us talk about, fibroid as to what causes it, right? It's a multifactorial cause where you have the body response to the hormones are higher, increased response, and there is some, we call them endocrine. So it's a multifactorial where different things cause it, right? Endocrine disruptors, there are some risk factors involved where low vitamin D, let me just take this away, low vitamin D implicated, and also your microbiota, that is the microbes in your body, they're all, all these things contribute to fibroid. And there are certain genetic or ethnic predisposition that we know in Black Hispanics, they have higher incidence. Now, the fibroid, the cells, the DNA, so what they're saying is that all these factors, they disrupt the DNA. So DNA is your programming of your cells, how it is, how it replicates, right? The DNA controls the replication. And when you have those programming go bad, so you have some form of DNA maladaptation or DNA disruption, it causes fibroid to form. That's the general theory in the formation. So you can have a fibroid depending on how you manage it. So if you manage it, let's say with hormones, you're blocking the hormone, you're suppressing. So what we do there, we control the growth of the fibroid. We don't necessarily destroy the fibroid, but we shrink it sometimes and we control the growth, right? So the problem is, if you were to stop that treatment, then it can regrow or it can get bigger. And also, if you surgically remove it, you can still, depending on what extent you have removed. Remember, the cells, when you're removing the fibroid surgically, you're removing that big mass, but you can have cells remaining, and those cells can grow again. So the answer, can it recur? The answer is yes. And sometimes you have multiple fibroids where you just remove just a piece of it, and there's a little small chunk of it remaining that grows. That fibroid can come together in different sections.
Wow.
So yes,
it can go back.
It can go back, definitely.
All right. The next question here is, Doc, is it true that extra estrogen can cause fibroids to form?
Absolutely. So in that little bits that I just talked about, how do you get formation of fibroid? In that whole pathogenesis, or the formation as we say it, you have the body hormones is an integral part of growth of the womb, right? And fibroid is a tissue, a womb tissue, right? The muscles of the womb cause go into the fibroid, and it's a response. So that hormone, your hormone, estrogen, stimulate the fibroid, stimulate the uterus, so it will cause growth of the fibroid. So hormones are generally well known, well established, and of course the other factors to talk about. So in the growth of or the formation of fibroid, you have those hormonal factors, and you have what we call inflammatory factors.
Mm-hmm.
And those inflammatory factors, where they are different components of inflammation, different chemicals that are involved, they then disrupt the DNA of the fibroid cells, and they just go widely into a different form.
Okay.
Yeah.
Yeah, and viewers, I just want to encourage you to continue to send in your questions. Dr. Saw, we were talking about leg swelling tonight, but you can send in your questions on any topic. Another question I have here, Doc, is well, this one is not a question, but sometimes when I see certain comments on the thing, I like to bring them to your attention here so that we can, because there are many people out there who might want clarification or answers to this. It says too much iron can cause liver disease, diabetes, and lead to cirrhosis.
Yes, definitely, that's indeed correct. So I talked last week about iron and how too much iron can get into the body and get deposited in your organs. Now, there is a genetic condition. So iron get a way of metabolizing in the body. The body has a way of handling the iron that it receives. So we absorb iron from the food, it gets into the body, it gets into the blood cells, and it transfers the oxygen in your body. Now that system is controlled by different chemicals in the body and protein and things like that. Now, if you have a condition where it's a genetic condition you can have, where that system fails and the iron gets accumulated in the body, but also you can have iron from external sources. So if you have too much of extra supplemental iron that is very high, if also you have too much blood transfusion, so people with sickle cell, thalassemia, who have got lots of transfusion, remember when the blood cells are broken down, the iron stays in the body. So the cell die, it gets broken down, but the iron stays in the body, and that gets accumulated in the organ. So if it gets accumulated in the heart, you can get heart failure. You can get something called cardiomyopathy. It gets accumulated in the liver. It can give rise to cirrhosis. It gets accumulated in the pancreas, and you can have diabetes. The pancreas can't produce insulin. It can't function well because you've got iron deposits in it. So that's definitely, usually it can get accumulated. Extra iron can do that.
Okay, great. Next question here is, Doc, can contraceptive cause weight gain while it helps to regulate the period? Well, I know a lot of people, excuse me, a lot of women would say to me that one of the reasons why they put on a lot of weight is because they're using this pill.
Yeah, well, we know. I mean, let's look at why a woman go into puberty and gain weight. They gain weight because of estrogen effect of your hormone. You go into puberty, you start producing female hormones. Your body is now mature where you can have a pregnancy, and in so doing, the body, the pelvis. So there are many factors involved. You get fat deposits around your waist, your hips, your breast, and all of that. They get larger, and you get fat deposits there, so you gain weight. So that is one hormonal effect where you gain weight due to that. Secondly, you can have more water retention, and you gain weight from that as a result of that as well. And yeah, so there are various mechanisms where hormone is one of the side effects in contraceptive pill would be weight gain.
Okay, great. While we were talking about heavy menstrual bleeding, this was one of the comments that came through, and it says, "I used to bleed so bad, I end up sleeping with a pull-up. So just not to soil my bed. I think. How serious is that, doc?
Well, I've heard and I've seen patients actually who bleed heavily, heavily. They bleed so like half their body's blood.
Wow.
You know, their blood count will drop to about, seven, six, seven, and that is because purely because of their period. Now, if your blood count drops suddenly, you will have symptoms as in shortness of breath and dizziness and those faint episodes. But sometimes your blood count can drop slowly, and your body adjusts and try to compensate, and you don't feel it as much, and you don't know until you have a blood test. But there are times when women bleed profuse, a lot. Every day, patients come to me and say, "Doc, whole 2 3 months I've been bleeding,"
Wow.
and it's like they're having the period continuously.
Yeah, 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 yeah.
And of course, again, there is something called dysfunctional uterine bleeding. We talk about that when we talk about heavy periods. And they used to call it, in the old days, we stay away from that term, dysfunctional uterine bleeding. We have abnormal uterine bleeding where they don't know the exact cause. So it's like a mechanism where there's a hormonal imbalance, generally speaking. So you have lots of chemical and hormonal factors involved, and also what we call uterine factors like the muscles contraction and some chemical responsible for clot formation. So the clotting system, the hormonal system, all of those systems, when they don't sync together, you can have this abnormal bleeding and you bleed. And I've seen cases where last resort is that we have to remove the uterus because we have tried. So I say to you that there are things we will do for heavy bleeding. We will try with contraceptive. We'll try balance back the hormones. So we'll give you uh, the contraceptive pill, for instance, or other forms of hormone where we try to get balance right. Sometimes we give you drug to create menopause. So we just lock the hormone altogether because it's that imbalance causing it. So sometimes we don't get to balance it right. So what we do, we give you medication to block the whole lot, and then we replace what we want to replace in a controlled way. So these are some of the treatment that we can use. But yes, it's a very, and then if all of that fails, then of course you just go straight and you remove the uterus. I mean, well, you of course you can remove the uterus as an option if everything fails.
Okay. Next question is, how serious is a endometriosis condition?
Can be serious. Thankfully, most people probably don't have so serious endometriosis. But endometriosis, as I explained, is the lining of the womb, the internal lining of the womb is called the endometrium. And that's the lining that increase due to the hormonal stimulation in preparation for an egg. If it doesn't happen, you shed that lining and you have a period. Now, that type of cells in that uterus gets into different parts of the body. It can be in the ovaries, it can be in your bladder, it can be in your bowel. Now, imagine those cells are there and they can cause bleeding into those organs, right? So you can get bleeding in the ovaries as a result of those endometrial tissue. Now, how serious it can be, one, it can cause blockage of your tubes. So if you have that lining in the tubes, it causes blockage, so you don't get pregnant. So lots of people with endometriosis, sometimes it blocks the flow of the egg. The egg doesn't pass from the egg where the ovary is. It goes through a tube and then it goes into the uterus to get grown as a baby into the womb. So you can have a little blockage there. But lots of time it can cause, if it is deposited on the bowel, you can have what we call adhesions or even the wall of the tummy.
Okay.
Where it gets clustered together, they get pasted together.
Mm-hmm.
So we call it adhesions, and endometriosis can cause that. And you can have even a severe form of it where it creates what we call fistula. It punctures the bowel and
Right,
it
right.
forms a connection. And then you can have fistula in between the bladder and the bowel.
That's right.
So it can be a severe condition, notwithstanding the pains that you get with it. You get severe pain as well. So it can be a big surgical thing, and I've seen patients who had their ovaries out, they have bowel surgery, they have repair of adhesions. I mean, at initial lysis, we call it breaking down of adhesions. They have bowel resection done, all because of endometriosis. They sometimes ended up with a bag. You know that bag where you bring
Yes.
the bowel out, and you have you pull through that bag, um, and just because of the endometriosis.
Doc, I've seen some documentary I was watching about fistula where some people would even pass fecal matter through their urine because of that
Correct,
because
correct.
of that
Right.
what's
So
happening there.
fistula is when there is a connection between the two. So you can get your bladder connected to your bowel,
Yes.
and the feces get into the urine. And that causes lots of infection. You can get abscess formation because when you have infection, you form an abscess. You get septic. You got to go and remove the whole lot, and it's big surgery, and it's quite infective type of, your organs get infected. You get sepsis. You can die seriously sometimes.
Wow. This one here is similar. It's a follow up to what we just discussed there. Doc, can you elaborate in details more about the non-surgical way of getting rid of fibroid? Well, in details, I mean, we have a very short time here. I don't know if you can do that
Yeah,
shortly or you want to
but
do that separately
no.
because
Well, I
we
can
did that in
talk
the
about that.
previous we did
We
some
did that because
in the
all in the
previous one.
previous
Yes.
one, if that person can go back to my
Yes.
heavy menstrual bleed, I think on a question, remember we dwell on the question of fibroids
That's
and
right.
how do you manage the fibroids,
Yes.
and the non-surgical management would involve hormonal manipulation, and the hormonal manipulation would be your contraceptive pill. You then use the either or you give the hormone alone to stop the period. You just get progesterone hormone, and so you don't get any bleeding. And then we have different hormones where you injections where you can block all. You create a
Right.
menopause, and then now there are some new tablets came out in the past 5 years, 4 or 5 years, even earlier than that, 3 years. Different types of tablets where they're called GnRH antagonists. Before we used to give injection to create menopause. Now you can give that antagonist drug, we call it, to create a menopause, and then you add back the hormone on top in a controlled way. So that's your non-surgical way of managing fibroids. And before that, of course, you have these the tranexamic acid and mefenamic acid. They're very mild just to control your bleeding. But yeah, that's about it. And you can have surgery as in you go and cut the fibroids out. We can do a procedure where we block the artery that supply the fibroid. So the uterine artery takes blood to the fibroid. So they inject something to block the artery. So you
Hmm.
go through the groin into the blood vessel, put a probe up under guidance, and you inject a gel and it blocks the blood flow to the fibroid, and the fibroid shrinks and it falls off sometimes.
Okay, great.
But
This
that's a type of a surgery, but less invasive,
Okay,
minimal.
okay. This next question here for the host, can you kindly have a
That's for you
show?
then.
Yeah, can you have a kindly have a show about the topic on fibroid and anemia? So what I want to say, viewer, probably if you watch the show before this one, before last one when we did menstrual bleeding, we dealt with anemia. So if you were able to put those two shows, if you can watch those two shows, I think it will answer most of your
That's
questions on these two
correct.
topics. Yeah. Next question is that okay? This is not a question. You were talking about the coil, and this person says that coil got septic in me, nearly cost me my life. I was hospitalized. Um, did this seem serious? What
It
coil?
is.
How can that become septic, doc? Quickly.
Okay, so the coil is a foreign body,
Hmm.
and your body has a way of mounting a response to get
Yes.
rid of foreign body.
Yes.
Secondly, that foreign body in you can change your normal equilibrium of the bug in your body, for instance, let's say. All right? And it can be a haven where it allows the bug to grow on it. So if you have any, so that's that's like when people have knee replacement or any replacement of the body, you get infected. What tends to happen? And it's not just an ordinary infection where the bacteria there and you give some antibiotics and they go away. If the infection gets stuck into that hardware, that foreign body,
Right.
blood doesn't flow into the. So how do you get rid of infection? If you have an infection in the body, the blood sends some white blood cell, and it flows into that area of the body, and the white blood cell engulfs it and kills the bacteria. So think about you have something that doesn't have a blood supply. So I put a pen in you.
Right.
Now there's no blood could flow into this pen
Yes, indeed. Yeah.
to kill the bacteria. So the bacteria sits in here and it's in here.
Yeah.
So blood can't flow. There's no blood vessel. There's no tissue fluid to get into here. So that it grows the bacteria,
Mm-hmm.
and the bacteria get build up and it get overwhelming. The body can't handle it now, and you get septic.
Wow.
So, however, I would say to patients, if you've got, I mean, I can tell you what, to be honest, the Mirena coil is sometimes for lots of patients, it is magical. It changes their menstrual history so much so they get less bleeding and control, sometimes no bleeding at all. So I have seen the Mirena coil working very well in lots of patients. So I would not try, I would encourage patients generally, because lots of time for you to take tablets is a little bit of a chore.
Right.
A
Right.
daily thing. You have to take all these tablets you don't remember. So patients for ease of taking something, they say, hey, let me put a coil in, leave it in. I don't need to worry for the next few years.
Okay.
But if you start having symptoms where you're having discharge, so you will know when it starts getting infected. You're getting vaginal discharge, you have smelly discharge, you've got tummy pain, pelvic pain, you get, all these things. Hey, something is not right. And maybe just a one-off antibiotics, fine, I've taken antibiotics 2-3 courses, and I'm still the same. Know that, hey, I've got a foreign body in me.
Mm-hmm.
Let me get rid of the foreign body.
Right. Right.
So I would say generally, I will tell viewers, if anyone, in that situation where they have a coil in there and they're having smelly vaginal discharge, tummy pain, fever, feverish symptom, see the doctor, probably get it removed, and you can even treat it and reinsert another one maybe at a later date to see if it does the same thing. We don't know.
Okay. Great.
But yeah, it's a serious and it can lead to septic, so you got to be careful. But that should not, take away from the fact that it's a very good means of controlling bleeding.
Okay. Great. This one here. What if a woman at 65 who is spotting tests done in the US so far is negative? I don't know what when she said negative what she was referring to, but you'll know.
I would probably understand that a little. So I said to you earlier, and when we do bleeding, that anyone who's bleeding greater than postmenopausally, so
Mm-hmm.
after you have your menopause, you're supposed to stop bleeding, right?
Mm-hmm.
You're not getting periods anymore. That's the end of your bleeding. So it is compulsory that if you bleed after menopause, you start bleeding again, you have to rule out cancer. Full stop.
Okay.
So when she said test negative, that means the cancer test is negative.
Okay.
And what cancer are we talking about? We're talking about endometrial cancer, that is the lining of the womb,
Mm-hmm.
cancer of the womb.
Right.
And how do you rule that out? So first we will do a scan first. So first we examine to see if there's anything you can see, internally. Then you do a ultrasound to see the womb and the lining of the womb. And then you can put a camera into the womb, and then you have a look around, and then you take a sample of the womb, and you send it to the lab. So in this patient's case, I would imagine, if the test is negative, that means the biopsy, when they put a camera in the womb, you want to know if the lining of the womb is cancerous. So they would have checked that it's negative. But bear in mind, you can still bleed for many other reasons. So what that person is alluding to there is that the test is negative, meaning there is no cancer.
Right.
But let's say, for instance, you have a blood vessel that's tortuous, or we call it like an AV malformation, where the vein and the artery get a bit swollen. You can have a spontaneous bleed, like in patients who bleed from hemorrhoids or a rectal bleeding, and we check and there's no hemorrhoids, but the blood vessel in the bowel has got a little malformation and they bleed. So you can have a vessel in the body that is bleeding that is giving you the spotting. You can have something on the cervix, like something called polyps. You know, you have these skin
Right, right, right.
tags.
Yes.
You can have it in the bowel or in the cervix, in the vagina. Those things can bleed. So that person would have to have, if there's no sign of cancer, they probably would have to have an examination internally like when you're doing a smear, you have a look, check the cervix, check the walls of the vagina, ensure that. Another thing, blood thinners. If the person is on a blood thinning drug, it can cause a bit of a bleeding. And sometimes you get just a spontaneous rupture of blood vessel, give you transient bleeding, and that might be the cause. So yeah, I wouldn't say that it's good news that well, if you test negative, then fine, we're happy with that. But they
Okay.
can go a bit more detail and see if it's a blood vessel issue or something like that.
All right, good. Last question here. Doc, can you please deal with? So this person apparently is having cramps in their feet, right? And they wanted us to deal with this question last week, but obviously we answer
Okay.
we will be answering question this week. Leg
Mm.
cramps.
Well, leg cramps, it's a common condition in patients as you get older. Sometimes you get leg cramps, and there are various reasons that can cause leg cramps. So, first, I tend to investigate patients a little to ensure that they're not deficient in certain things.
Mhm.
So, deficiency, let's say you are vitamin D deficient, your calcium is low, your vitamin D is low. Um, there are certain, your magnesium is low, so these electrolytes and these chemicals, they cause contraction of your muscles in a coordinated way. They're responsible for your nerve and all of that. And if those levels are low,
Mhm.
you can get excessive cramps. But the majority of cramps, we have it as a result of what we call idiopathic. We don't know why. I will test the patients. We'll look at all the vitamins. We'll do all of that, and it will still be, yeah. Sorry, let me take this out.
No, that's all right.
It will
Mhm.
still be, yeah, it will still be, everything is normal and they still have cramps. And that's idiopathic. We don't know the cause of the cramp. But muscle fatigue is that when we look at those patients, and there's a study being published, that if we were to do exercise on these patients, where to do stretching exercises, they half of them get better just by comparing stretching exercises and giving them medication. It They get better just with stretching exercises. So the muscle can be in fatigue. So if you overwork a muscle, so a lack of use of a muscle, and then doing certain exercise can cause fatigue of the muscle, or too much use of a muscle can cause fatigue of the muscle. And the
Right.
other condition that you would want to exclude would be blood flow to the muscles. So there are something called peripheral vascular disease. So like when you have angina of the heart and there's not enough blood flow into the heart, you can get angina of the muscle, not enough blood flow into the muscle. But classically, those patients, when they walk, they will have to stop because there's not enough blood to the muscle. We call that claudication. So you walk, you take a rest, you get pain in the muscle,
Hmm.
in your calf, you stop, the blood flow again, you walk again, you rest again, like that. So that's like angina of the muscle. And you can get it also, you know, in your legs at night. And some of those patients, they hang their leg down from the bed
Right,
if you
right.
get peripheral vascular disease
Yes.
because the gravity pulls the blood down and they hang their leg down the bed. So I would say to this person, cramps at night, first get yourself checked for your vitamins. So I want to do your iron, your B12 folic acid, your magnesium, bone calcium, vitamin D, and make sure you're not anemic. All right, so that would be your baseline test, and yeah, what else? And then of course have a check to see that your blood flow is okay. So your doctor will test for that, and then if all of that is good, now the management we can try. Quinine is traditionally been used. Quinine, I don't know. You get quinine tablets, and they also in tonic water. Tonic waters got quinine. I don't know if you know that.
No, no, I didn't know. I
Um,
didn't know it had the twinning in it.
yeah, well, I don't know you go gin and tonic.
Yeah.
There's some quinine in that.
Yeah, yeah, yeah,
Gin and tonic.
yeah. All right.
So yeah. So we prescribe. I prescribe quinine tablets. Vitamin K as well is as an alternative. It is shown that vitamin K can decrease cramps. So I would say those are the kind of things I would want to use. But of course, have some checks before.
All right,
And that's
doc.
it in summary.
Well, thank you so much. One another question that came in here. I don't have it here with me, but people were. I'm over to one person. When is Doc coming back? When is Doc going to be back at his clinic? So
Good question. I mean, I can't give a definite answer right now.
okay,
I've got a few bits I'm trying to do, and as I say, my daughter's got
right,
exams and
yes,
stuff. So
yeah,
I'm trying to support her, be around, see her through that.
mm,
And once that's all done and I finish my bits, then of course I'll be back. But I mean, this is quite interactive, and I get to do even not being there. That's why I felt that if we were to do this in Zoom, I can then carry on,
indeed,
doing educational work. And I would say to patients, if they have a scenario where I don't mind patients contacting me directly, and I can have a discussion with them. So I don't know how we can probably do that, and anonymously we can discuss case scenario.
right.
So that might
Well,
be
what I can do,
interesting.
what viewers, if that's the case, then you can contact me, and then we can make, you contact me via my telephone number 652-1314, and then I will take it from there, and then we will get it done, and I will transfer
Yeah,
you
I
to, I
can
will
then have a
get
consultation
right.
online. I mean, like chat with that person, call them up, do
Yeah,
either a video call or do a telephone consultation, and get a bit more better understanding of what it is. Because I tell you what, during the COVID time, three-quarter of our in the midst of it, I mean, 90% of the consultations were happening via telephone and
that's right.
telemedicine.
That's right. Yes, yes.
And even now, sometimes, some days I do half my clinic on telemedicine.
Okay.
Because lots of patients, for convenience, they are at work, they want to troubleshoot something, they call me only if I need to examine. And nowadays, there are lots of gadgets you can have. I can have your blood pressure done at home, I can have your temperature done at home, I can look into your ear at home. There are gadgets you have at home.
Wow.
You can go into a center where you can have your eye images done, you have your ear looked at, you can have your heart listened to, your lungs listened to while
Wow.
you're at a different location, and I'm hearing it. So it's
Yes.
like I put in that stethoscope. So what else is there? If I want to feel your tummy, maybe I send you for ultrasound, which is non-invasive, and I see everything. So just talking to you, having those virtual examination done, and then reviewing your records. I can have an ECG done while you're away. I just look at that now, look at your medical report, understand that a little bit more, and then I do a prescription, and it goes electronically to your chemist.
Right.
You get
Right.
your drug. So
Electronic healthcare is going places, Doc, and I believe that you're one of those persons who can really introduce a number of these things here in Guyana. Doc, thank you
no,
so much again.
indeed.
Just
You're welcome.
just from us, all of us here, in our viewers, that just let your daughter know that we are rooting for her. She's got a whole lot of people behind her here too. Okay, so
Thank
we're
you,
rooting for
thank
her.
you.
Doc, thank you again so much for joining us tonight, viewers. It was such a pleasure having this conversation with Dr. Saw, and to be able to take your questions and asking Dr. Saw about them so that you can get the right answers. We look forward to having you again next week. Thank you so much for joining us, and do share this information with all your friends and family. As I would usually say, stay healthy and look out on the roads for those who are not looking out for you. Have a wonderful evening, everyone.
Thank you, Akash, and the team and viewers. Thank you.
Okay, bye.
Okay, good night.